The honourable member for Courtenay-Alberni.
Speaker, and Madam Speaker, at the beginning of the pandemic and throughout the pandemic, we've heard very clearly from medical health professionals. They've said two things that are the top priority for us to protect people in our communities, protect the health of people in our community. Get vaccinated, and for governments to bring forward paid sick days, Madam Speaker, so they're not infecting their workers when they go to work or making a difficult choice whether they're going to pay their bills or go to work. Now, it's great to see the minister today talk about seeing the light, and it's good to see the Conservatives, the official opposition, who've sat on their hands on this issue, finally getting on board, Madam Speaker. Now, CBC cited that 100,000 women have actually been completely left the workforce. 10 times that of men, Madam Speaker. We know there's many reasons for that. The lack of childcare, social supports for women throughout the pandemic, that's surfaced. But one thing we know is that, and hopefully my colleague can agree, that many women are going to be coming back to work in precarious work. They're going to be coming back on contract. The amount that has come back to work that are going to not meet the 11-month threshold, so they're not going to get full 10 paid sick days when they come back to work. I'm asking through you, Madam Chair, does a member agree that this needs to be fixed? Because the fact that it's going to take workers 11 months to access the full 10 days of paid sick leave, that this will disproportionately impact women even more that are already facing challenges of greater risks of skills erosion, potentially hampering their ability to get rehired and the transition to different roles in the economy as a result of them disproportionately being impacted by COVID-19.
Honourable member for Winnipeg North.
Thank you, Madam Speaker. What I do know is, given the general will and sense of cooperation inside the House, I'm very optimistic that this bill will, in fact, pass and go to committee. Where at committee, I'm sure that the member or the critic for the NDP will no doubt be raising this issue in more detail, so there will be a more detailed answer. Suffice to say that the government brought in paid sick days back in 2019. NDP BC recently has followed, as opposed to we suggested 3 days at the beginning. Now we went to 5 days in BC provincially, which is fantastic. But now this government has made a commitment to bring it to 10 days. And I think all round that's a good thing for workers, in particular in BC, but across Canada.